Hello students, my name is Liz Attia and in today's topic we're talking about principle-based ethics and the concept of autonomy. Okay, so principle-based ethics and autonomy. So as we actually said in week 1, there are 4 principles which underpin healthcare practice: autonomy, the idea of an individual choosing and having the right to choose for themselves; beneficence, the idea of doing good; non-maleficence, no harm; and justice, which looks at equity and distribution of resources. So focusing on autonomy, it comes from the Greek word autos, which means self, and nomos, rule, so the idea of self-rule. It was propagated quite strongly in terms of writings by John Stuart Mills, who wrote in 1859. And he argued that over himself, over his own body and mind, the individual is sovereign. The idea of autonomy came about as a strong rejection of what was the underlying principle at that time in healthcare practice and more generally, this idea of paternalism, where the society itself and health professionals in their role as experts directed and took over a parent-like role in that therapeutic relationship, where people had things done to them without actually knowing what it was for, and what it served to actually achieve. So it's a strong rejection of that philosophy of the expert professional and the subservient client who simply has to go along with the advice and opinion of the health professional. And it's promoting the idea that really over oneself, one has the right to actually make decisions free from coercion, interference, or and should be self-directed. So it's based on this idea that humans have a right to non-interference when making decisions about themselves. And I will draw your attention to this idea of right, that it is a basic human right that we have sovereignty over ourselves. And this idea of autonomy is quite prevalent even when it goes to the legal obligations of health practitioners and professionals towards their clients. So it's not only an ethical consideration, but it also underpins the legal issues when it comes to therapeutic and clinical health relationships and client intervention. How is this actually seen in practice? Well, autonomy requires practitioners to respect the rights of their patients to make their own decisions in accordance with their own values, even if this is at odds with the practitioner's own ethical base and ethical values, and that must be respected. So clients will sometimes, and patients will sometimes, make decisions that the practitioner or the professional doesn't respect and doesn't sit well with them, but if they are deemed and assessed as competent decisions, that must be respected. The right to refuse treatment. So it allows competent patients to be informed and maintain control over the decisions that affect their health. And like I actually said, it was a direct knee-jerk reaction to some atrocities which were happening both in medical research and medical intervention, where people were having things done to them, irreversible in some instances, such as lobotomies, and extensive research which compromised quality of life and had a detrimental impact on health and in terms of life generally. So many patients actually in fact died from some of these intrusive procedures based on experts doing things to people as opposed to for them and with their consent. And it ensures that decisions by patients are voluntary, based on adequate information and discussion. So the role then of the professional is to provide support and assistance and to, if you like, counsel, in inverted commas, through education and information clients on options, but it's not to enforce or to direct a particular decision. And it goes to then ensuring, because of this nature of the relationship, upholding patients' trust in their professionals and in the people who are actually servicing them. So it upholds patients' trust and confidentiality and gives confidence to the role of health professionals, and that they're acting with integrity towards their patients. Thank you, students. That brings today's topic to an end.